US President Joe Biden is to announce that the United States will double its global donation of COVID-19 shots, aiming to vaccinate 70% of the world's population within a year. The new commitment would see an additional 500 million doses donated to the UN's COVAX program. Mr. Biden is to host a COVID-19 summit of world leaders on the sidelines of the UN General Assembly about doing more to curb the pandemic and encouraging the global recovery. Well, since the pandemic began, more than 220 million people have been infected with the novel coronavirus, resulting in more than 4.6 million deaths. Around 31% of the world's population have now been fully vaccinated, with the vast majority of those in high-income countries. The pandemic has cost an unprecedented number of people their jobs. In 2020, around 252 million jobs disappeared, and so far this year, only about half of those have returned. Women, migrant workers and young people have been worst affected. Young people also missed out on education, each losing an average of 74 learning days last year. That's a third of a school year, with students in low-income countries losing even more. Well, the key to ending the pandemic, of course, lies in vaccinations. On Tuesday, UN Secretary-General Antonio Guterres described the unequal distribution of vaccines as an obscenity. The situations in countries around the world, of course, is vastly different.
For millions around the world, life is back to something like normal. 50,000 at a concert in Denmark. Really, what corona? Easy to say in a country where 80% of people are vaccinated. The scene in Afghanistan couldn't be more different. This desperate man, one of many, critically ill, alive only with the help of a fast-diminishing supply of drugs, oxygen and faith. Our country is a poor country. We need medicine, different things, almost everything. If someone will come and give us something, and the patient's problems will be resolved with Allah's mercy. This is what I ask for. Quite how bad things are is impossible to know, as testing here is almost non-existent. In Togo, these people are lining up to protect themselves after the government introduced a COVID-19 pass system which only allows vaccinated people into certain places. Yes, if they had not done this, I really wasn't thinking of getting vaccinated. Persuading people is only half the battle when there are just 1.6 million doses for 8 million people. Here at Rio de Janeiro's Remembrance Forest, they're planting trees for the dead. It's in memory of my husband who died of COVID in March of last year. It's hard to talk about. Even after 500,000 lives lost, Brazil continues to be a hotspot. Just 50% of the population have been vaccinated. In part, because of scepticism fuelled by President Bolsonaro, including this awkward exchange with the British Prime Minister recently, which underlined just how difficult orchestrating a global response to COVID-19 can be. But as the cameras are shuffled out, the Brazilian wags his finger in protest. Not yet, he says.
Well, let's consider the global response with Candice Sehoma. She's an advocacy officer with the Médecins Sans Frontières Access campaign in South Africa. She joins us from Johannesburg. Welcome to DW. Let's talk about the COVAX programme, which was set up by the UN to ensure equitable distribution of vaccines to poorer countries, with richer countries pledging money and vaccine doses. So given that it is up and operating, why is it that large proportions of the world's poorest countries are still unvaccinated?
Thank you so much for having me on your show. I think it's a good question. And currently what we're seeing is that there's a global imbalance in the current vaccination rollout. We're currently seeing large numbers of vaccinated populations in the global north because those countries have stockpiled vaccines, leaving lower and middle income countries scrambling. And even, mechanisms like the COVAX facilities even scrambling because they cannot, because, the large, or rather the high income countries have actually stockpiled vaccines. And I think what we're seeing is that, there's some, comments and opinions that, there's issues of hesitancy, and that's why we have low level, rates of vaccinated people in Africa and low and middle income countries. But truly, we also have seen studies that have shown that there's low levels of hesitancy in these countries, but actually there is an issue of supply and getting access to these vaccines, and which is actually a problem and really makes you question the current approach in terms of.
So just to be absolutely clear, you've talked about the stockpiling in the richer countries. Does that mean that the COVAX program is short of vaccines to distribute? Because if it isn't, then that's not a reason for those countries to be short of vaccine, if you understand me.
Yeah, so it is an issue of, the COVAX facility not being able to access vaccines. There is obviously resources to buy these vaccines, but we have seen how, countries like the US, the EU, stockpiling, and there has been some campaigns running, trying to get and encourage these countries to donate their vaccines.
We heard that. So just to be absolutely clear, you're saying that COVAX is short of vaccines. COVAX does not have vaccines to distribute at the moment.
Yes, what we're saying is that for us to be able to reach, or for the COVAX to also be able to reach, they targets, there has to be vaccines, and currently there isn't enough vaccines to also redistribute in low and middle income countries.
Okay, so
because of this stockpiling.
Understood. So what do you think then when you see richer countries like Germany and the UK giving third jabs, giving booster shots to their elderly and at-risk populations?
Yeah, and I think it's quite a bizarre thing, to be quite honest. I think what we are saying is that governments and pharmaceutical corporations shouldn't be planning to administer, vaccine shots until everyone has actually received a vaccine, and we're seeing low levels of vaccinations in Africa, where less than 3% of the population have been vaccinated, and even some health workers and very vulnerable populations haven't even received a first dose.
Understood. We're short of time. I absolutely get that. What difference do you think President Biden's new approach, his appeals for a global vaccination campaign, his promise to double the United States' contributions, what difference is that likely to make?
I think if we're going to use the current model of, charity model, because, there has been some, commitment to say that they will donate vaccines to these low and middle income countries. If we're going to go with that model, honestly, that's not sustainable. We need a much more sustainable approach that would allow for countries to be able, especially capable manufacturers, to be able to manufacture vaccines so that we can meet the current demand. Because at the moment we don't, with the current approach, it's not very sustainable. And considering that there's a lot of hoarding, it doesn't really help. But if we're going to have an approach that ensures that we have more manufacturers, more companies and countries producing, that in itself is actually a model. And that's what we're saying, that, with the current calls for a CHIPS waiver, to allow for countries or other companies to manufacture, that in itself would be sustainable to ensure that we meet the demands that we're currently facing.
Candice Ahoma from Médecins Sans Frontières, thank you so much.